our implants for hips, knees, spines, we have to get them at time of surgery. They'll measure up during surgery, and then we go to our implant cupboards and get them as and when we need them. The main issues we've got, implants, we have such a vast amount of implants. Doing the date check, stock check, it's time consuming. It's not really a job that you can do unless you know what implants we need on the shelf. You never quite know when you haven't got enough stock or you've got too much stock, when stuff's expiring. It's pretty much a full-time job on its own, trying to keep track of all the implants. Sometimes you go to the cupboard and there's nothing there, then you end up walking over to the other side where we keep all our stock at the moment, and you've just got to try and find what you need. It can be time consuming when we could use that time better doing our team briefs, getting ready for the patient. I think our major thing from orthopaedic side is our implants. Every patient is a different size, so you have to have all variety of sizes available on the shelf. If the patient comes in and you haven't got that specific side or that size, then that patient will get cancelled because the surgery can't go ahead. From our side of things in orthopaedics, our main concern for patient safety is having the right implants available for them. Currently, it's a massive task in the morning. We have to check all the implant cupboards, make sure that we've got all the sizes, everything's in date. You can be rushed in the morning, human error. It has a big impact on us. I think doing it digitally rather than manually will be a massive impact for us. We'll know exactly what we've got on the shelf. We'll know what's in date, what's going to go out of date. From a cost side of thing as well, that's going to have a big implication so that we haven't got too much overstock on the shelf. Patient safety, having a digital way of keeping track of our implants and our consumables, it will have a positive effect. You know, we can make sure that the patients that we've got coming in for surgery, we have their right implants, we've got all the consumables that we need on the shelf, everything's in date. It can be reordered, so if it's needed for the next day or the day after, then it's going to be in for that consecutive patient. It's important that we don't have too much stock on the shelf. It's getting that right balance, and I think this will help us achieve that. Our current practice with our implants is quite ancient. Pre-Alex Health, because we're very new to Alex Health, we would do our all-miss care plan, and in our comment, say for hip, you've got 5 implants, so you'd list down there, we're using Trident Exeter, which is a type of hip we use, and then you'd write stem, and then you'd write the size of the stem, and then you do your shell and your liner, and you'd write down them, plug and your head, and then you get pack of stickers in each of the implants. So we do one on the NJR form, one on the patient's notes, and then one in a sticker book. Every day the sticker book gets taken to James in the office who does our ordering, and he orders whatever we've used that day. So it is all on us remembering to take the book and make sure that all the implant stickers are put in there. But we have had cases over the last few years where we've had a lot of implants delivered that we didn't necessarily need. So we're paying for stuff that we don't actually use all the time. From the safety point of view and the stock, I think it's going to save so much money. It really is. Once we get our stock levels and we know what should be on the shelf and the system knows what we should have on the shelf, it's going to just make a massive impact. I'll just tell them to shut up. Yeah.
Sure, you don't mind?
Yeah, no, of course not. You have to be quiet because we're filming. Sorry.
Yeah, I'll just start asking questions again.
Yeah, I'm never going to remember what I said, so it'll be something.
Yeah.
Yeah?
That's perfect.
Done?
Yeah. Thank you very much.
Better go and do some work then.
Yeah.